Screening and testing for TB is also important. There are two main types of tests: the tuberculin skin test, TST, and the interferon gamma release assays, IGRA. Tuberculin skin test, TST. The TST is a classic. It involves injecting a small amount of tuberculin, a purified protein derivative, just under the skin of your forearm. After a couple of days, you go back to have the test site checked. If there's a raised bump, it might mean you've been exposed to the TB bacteria. The size of the bump helps determine if the test is positive. Interferon gamma release assays, IGRA. IGRA is a blood test that measures how your immune system reacts to the TB bacteria. It's more specific than the TST and doesn't require a second visit. There are two main types: the QuantiFERON TB Gold test and the T-Spot TB test. Both are good options, especially if you had the BCG vaccine, which could mess with the TST results. So how often should we be testing for TB? It depends on the risk level of your environment. High-risk environments. In places like healthcare settings, correctional facilities, and shelters, regular testing is crucial. New employees should be tested before starting work and then periodically, usually annually. If there's an outbreak or increased risk, more frequent testing might be necessary. Low-risk environments. In lower risk settings, initial testing might be enough unless there's a reason to believe someone's been exposed. Protocols for TB testing typically include pre-employment testing. Ensure new hires aren't bringing TB into the workplace. Routine testing. Regular checkups to catch any new infections early. Post-exposure testing. If someone in the workplace is diagnosed with TB, test everyone who might have been exposed. Alright, let's say someone might have TB. What do? Here's a step-by-step guide. Identify and isolate. If someone shows symptoms of TB, they should be separated from the others right away to prevent spreading the bacteria. This could mean sending them home or placing them in a negative pressure room if they're in a healthcare facility. Medical evaluation. The person should see a healthcare provider ASAP for a thorough evaluation. This includes a chest x-ray and possibly a sputum test to check for the TB bacteria. Report and record. In workplaces, it's important to follow local reporting requirements. This usually means notifying public health authorities about the suspected case. If TB is confirmed, here's what comes next. Isolation protocols. Keep the person isolated until they're no longer contagious. For most people with TB, this means staying in isolation for at least 2 weeks after starting treatment. Healthcare settings should use negative pressure rooms and ensure staff wear proper PPE. Treatment options. TB is treatable with antibiotics, but it takes time. The standard treatment is a combination of drugs taken for 6 to 9 months. It's crucial to take the full course of treatment to prevent drug resistance. Directly observed therapy, DOT. In some cases, healthcare workers may use DOT, where a healthcare provider watches the patient take their medication. This ensures the patient sticks to their treatment plan and helps prevent drug resistance.